Welcome, everybody. Today we're going to map out a clear path for dealing with a super common condition, benign prostatic hyperplasia, or BPH. We're going to look at the whole journey, right from the very first signs all the way to the most effective treatments, all based on what the latest clinical strategies tell us. Okay, so here's what we're diving into. Think of this as our travel itinerary. We'll start with the big picture, the roadmap itself. Then, our first stop will be something called watchful waiting. From there, we'll check out medical therapies, figure out when surgery is actually the right call, and wrap it all up by talking about how you can choose the absolute best path for you.
So right off the bat, the most important thing to get is that BPH management is not a one-size-fits-all deal, not at all. It's actually a really structured path, a logical journey, where the next step is always based on how severe and frankly how bothersome the symptoms are for you personally.
And this slide lays out that structure beautifully. It's really like 3 tiers, or a ladder. You start on the bottom rung with the least invasive stuff, just keeping an eye on things and making some lifestyle changes. If that's not cutting it, you climb to the next level, medical therapy. And then for certain cases, at the very top, you have surgical intervention. It's a clear progression of care.
So let's make our first stop on this roadmap, watchful waiting. And just like the subtitle says, for a lot of people with mild symptoms, this is the go-to starting point. It's a situation where the best action might actually be, well, less action and more structured observation. Now, this isn't just a fancy term for doing nothing. It's a real, recognized medical strategy. And that's because we know that for a lot of men, symptoms don't always get worse. They might just stay the same, or believe it or not, sometimes they even get better on their own. So, if the symptoms are mild, and doctors often measure this with a simple questionnaire called the AUSS, where a score of 0 to 7 is considered mild, and it's not really wrecking your quality of life, just monitoring is the official first-line approach.
And watchful waiting is usually paired with these really practical lifestyle tweaks. I mean, it's pretty simple stuff, but it can make a huge difference. Drinking less water right before bed could mean you're not getting up as much at night. Caffeine and alcohol, they can irritate the bladder, so cutting back can really help. And some other medications you might be on can make symptoms worse, so just having a chat with your doctor about that is a really smart move.
So this is the obvious next question, right? For some people, especially if symptoms are more moderate or severe, just watching and waiting isn't going to be enough. And that's our signal, our cue, to move on up to the next tier of our roadmap. And that brings us to level 2, medical therapies. This is where we get proactive. When symptoms are more of a problem, we can bring in medications to actively manage them. And these drugs usually work by tackling the underlying mechanics of BPH.
What's really fascinating here is how these two main types of drugs work in totally different ways. On one hand, you have alpha blockers. These guys are the sprinters. They work fast. They relax the muscles around the prostate, which is kind of like opening a gate to let urine flow more easily. On the other hand, you have 5-ARIs. These are the marathon runners. They play the long game by actually shrinking the prostate gland over time. Think of it like slowly letting the air out of a balloon. So, a doctor might use an alpha blocker for quick relief, but a 5-ARI is a great long-term strategy if the prostate is quite large.
Okay, now this is a really important point about those 5-ARIs. Because they shrink the prostate, they also have the side effect of cutting your prostate-specific antigen, or PSA level, by about half. Why is that a big deal? Well, PSA is what doctors use to screen for prostate cancer. So if you're taking a 5-ARI, your doctor absolutely needs to know about it, so they can do the math and correctly interpret your PSA test results. It's a critical piece of information.
You've probably seen ads for supplements, right? Things like saw palmetto for prostate health, but it's always good to check what the official medical guidance is. And the American Urological Association, the AUA, is super clear on this. Their guidelines state that they do not recommend these supplements for BPH, and the reason is simple. There just isn't solid scientific proof that they actually work.
Which brings us all the way to the top of the ladder, the third and final tier of our roadmap, surgery. Now, this step isn't for everyone, far from it. It's really reserved for very specific situations, like when major complications pop up or when medications just haven't been able to provide relief.
And this slide spells out exactly what those situations are. Doctors call them absolute indications. We're talking about serious issues, like not being able to urinate at all, developing kidney problems because of the blockage, or getting bladder stones or infections over and over again. So you see, these aren't just about being uncomfortable. These are significant medical problems where surgery becomes the necessary choice.
So when surgery is the answer, what are the options? Well, they kind of fall into 3 main buckets. For a long time, the gold standard has been the TURP procedure. But technology has come a long way.
And now there are advanced laser therapies that can remove tissue with less bleeding. And even more recently, there are some amazing, minimally invasive options like UroLift or Rezum that can sometimes be done right in a doctor's office and offer great relief with fewer side effects.
So we've walked through the entire BPH roadmap, from just watching and waiting, to meds, to surgery. What's the final stop on this journey? It's all about choosing your path, and that's something you do with your doctor.
And if you take away one thing today, let it be this. There is no single right treatment. The best path forward is a shared decision, a conversation you have with your doctor. It's about balancing your specific symptoms, what's going on with your prostate, and, just as importantly, your personal preferences about potential outcomes and side effects. It's truly a partnership in your own health.
Ultimately, understanding this whole roadmap is about empowerment. It gives you the language and the framework to have a real, productive discussion with your healthcare provider. So, the only question left is the one for you. Are you ready to start that conversation?